From the beginning, people thought in research that you don't have to look at women separately because they have the same biology and physiology and everything is the same. So then if it's only men in the study, you can extrapolate the results to women. But that's not true. And still it's not good. And when you read scientific articles still, they include how many men and women in the study there are, but they don't analyze the results. Is this drug, has it the same effect in women as in men? They don't do that. And that might be very, very dangerous for women, because sometimes it's not the same effect, and women have more side effects than in drugs. As you know, it's very common that elderly women get a radius fracture, and they go to the casualty ward, they got the usual treatment, and then goodbye. And there is no follow-up. Is this the first sign of osteoporosis? And especially in the Nordic country, osteoporosis is very, very frequent, and it's number one in the world, the Nordic countries, with osteoporosis. So it's important to investigate it.
We know from studies that are made in Sweden that women and girls are home from school and work around 1 or 2 days every month due to period problems. And this affects 15% of girls and women in Sweden. So this is of course a big problem for women during this period of their lives. A girl that gets her first period and is having a big problem with this, with dysmenorrhea or heavy bleeding, they go to the nurse or to their mother and they tell them their problem, and the answer they get is that this is what it's like to be a woman. And as a gynecologist, I would say that this is wrong. There are so many good ways to treat menstrual bleeding, and there is no reason to have this problem every month. There is also this issue with dysmenorrhea and endometriosis. Endometriosis affects 1 out of 10 girls and women in the world. This gives a lot of problem in this woman's life. It means that she cannot work as other people who don't have endometriosis. She has a lower chance of having children, and it gives her a lot of pain and discomfort in life. I think there is a structural problem in society that women don't get enough of help for their bodies during the fertile period of life. There are so many women out there struggling with things that can be helped and fixed if they only get to see the right person and not get the answer that this is what it's like to be a woman. But this is not all. Urine incontinence. In Sweden, around 500,000 women have urine incontinence that don't seek help for this. Premenstrual syndrome affects around 30% of Swedish women, and polycystic ovaries that can give you severe problems later on in life, and also a problem to become a mother. But I can go on forever. There are so many problems that we don't really focus on when it comes to women's health. Menopause can cause a lot of problem for women. Around 60 or 70% has symptoms so severe that they need to see a doctor, but only a few gets the help that they need.
20 years ago, these issues about inequalities inspired me and colleagues to start the first in Europe Center for Gender Medicine at the Karolinska Institute. And still there is a lot of work to be done in 2023.
Yeah, there is still a lot of things to be done, but I think that we can start to, if we look back to the video, that there was representation of women in research, as Karin mentioned. Nora, I know that you recently wrote a report to on behalf of the Norwegian Institute of Public Health. What did you and your colleague found out?
Yeah, so it's interesting because, women are 50% of the population, and you would expect that women would be, of course, represented in medical research, but the history shows that for a very long time, women were excluded from all medical research, all pharmacological research, due to concerns with, potential babies being affected by testing, and for a long time women were excluded, which means that most of the research that we have had since before the 90s has mostly just been done on men, which of course we recognize eventually was a problem. And so in 2001, in Norway at least, we got guidelines that recommended that women are included in all medical research, and also that all research that is done on diseases and medical conditions that affect both men and women, you analyze the results separately for men and women so that you can find whether or not the effects, for example, of a drug are different for men and women. And there are very good reasons to do that. So we are biologically very different. For example, women have more fat and less water compared to men, which means that we absorb and we process drugs differently. So naturally, you would assume that medical studies would take that into account and look at the differences, right, in the results. But what we did find was that we were the first report to look at whether or not this is actually being done, whether or not the guidelines are actually being followed, and whether or not Norwegian treatment studies are taking into consideration sex and gender. So we were the first people to actually look at whether or not this is being done in a Norwegian context. And what we found was that 2 out of 3 treatment studies since 2017 to 2022, so a 5-year period, did not have any type of sex-based analysis. So they did not look at the results separately. Not to go into too many details, but in any type of ways, not even an aggression analysis, which is a huge problem. That means that the studies that we get cannot at all identify differences between how men and women react to drugs or other types of treatments, which means that information can't be disseminated into the medical community. It can't be disseminated into clinical practice. So that is a major, major problem that definitely has to be addressed. And now we've seen that there is some movement in this area. For example, the regional health authorities in Norway that own all the hospitals, every year they publish a report with key statistics on Norwegian medical research that's being done in the hospitals, in the public hospitals. And so this year was the first year that they published results on sex-based analyses done in Norwegian medical research. And they also found the same results that we found, which is that about 2 out of 3 studies don't have any type of gender perspective, no analyses.
So did you also include recommendations to the Norwegian government of what to do?
Yes, so we think that there needs to be a more systematic approach, that it's not enough to just recommend that researchers do this. It needs to be a systematic approach that you can see in every stage of research. So it comes, already from the planning and from planning studies and applying for grants, for public grants. It needs to be already on that stage. It's not enough to just think about this when you've already conducted the study. You need to look at the proportion of men and women in the study. You need to already have a plan for how you're going to process the data, how you're going to analyze, and how you're going to disseminate it. And so I think it's important that every stage you are concerned with sort of the gender perspective. So already from applying for grants, I think it's important that the public agencies that finance our research is aware of what constitutes good sex-based research, right? And then also, you've seen in Canada, for example, they've been very good at teaching researchers how to implement sex and gender. And so I think, that sort of increasing awareness in both financing, the agencies that finance our research, and also the researchers themselves, I think just increasing awareness and creating guidelines and demands for integrating gender perspectives into medical research.
Do you, Christine, in your work, you probably read a lot of articles about this. Can you recognize?
Absolutely. As an accident and emergency physician, I've always been extremely interested in stress and resilience. Resilience, what helps us survive through things and hopefully thrive through difficulties and challenges. And concerning stress, what really blew my mind was that up until 1985, 83% of all research concerning stress was done on males, mostly rats and mice and also some men. But this really affected not just this gender bias on medical treatments and health, but also when research becomes common knowledge. Because I think probably everyone here has heard about the fight and flight response in stress. If you raise your hands, if you've heard about the fight and flight in stress, I can see most hands are here. Who here has heard about tend and befriend response concerning difficulties in life and challenges? There is one hand. And this was defined in the year 2000. But up until, as I say, the majority of the research in the 20th century was focused on the stress and the fight and flight, and male predominated. And then up until 2000, it had reached up to about 1/3 of research on females and 2/3 still on men. It's improving in this century. But one of our responses to the difficulties in life and challenges is connection. And it's something that we both know, but it's also now they're showing through oxytocin, through endorphins, through physiological symptoms. This is a response where we strengthen our resilience and others by reaching out, by trust, by coming together. And this is a true response, tend and befriend. And I recommend, and I hope everybody will become as aware of that as they are about fight and flight. We need the both. And it's part of us, and all sexes. And men also make oxytocin, and also cats and dogs when we pet them. And this helps bind and increase connection. And even as I'm a very holistic accident emergency doctor, I've never seen the disconnect between mind and body. For me, it's one whole. And oxytocin also, as well as helping with connection and trust, there's evidence coming forward that it increases healing, that it lowers inflammation. They've even found receptors in our vascular system, in the arteries, which they believe is protection from stress when the system goes up. And I even love the fact that one group actually found receptors in the heart, which I think is absolutely beautiful, because when I was in medical school, we learned the heart is just a pump. But the artists and the poets, we've always known there's more to life and our humanity. And just having these physiological symptoms to express our humanity, I think that's a beautiful thing.
Yeah. Emma?
I think it's extremely interesting about, the unawareness on gender or non-sensitivity or gender blindness concerning research. And I do think that in public health statistics and data, we actually for a long time already have segregated gender. We know already that girls experience much more mental health, unhealth, depression. We can see from statistics from early retirement to early retirement that mental health is a woman's issue more there, and boys tend to be more outwards going in their mental unhealth. But I think that the next step from looking at this statistic is, of course, that we tend to react differently to what comes after these kind of health issues concerning men and women, and of course all sexes. I also think that the one thing that is very much some kind of bias is that there is a very strong feeling that there is suffering in a woman's life that goes together, that's how a woman's life should be. And I think that at the moment we're talking a lot about menopause in Finland because it has a lot of consequences when you're not sleeping, and you are like angry and you feel you really are unhealthy very, very strongly. You can be. And it has a lot of consequences in society, in your private life, everywhere, in your working place. And when you meet women, we have had also we have a play actually that comes to Stockholm, I think soon, that is called Är det hett här, which is a very funny play. And the women who go and look at it, they say that, I didn't know. Nobody has spoken about menopause because before they are there already many years, because they didn't have a clue. We are not talking about these things on women's health. We just think that this is just how it should be. So it's not only about analyzing, the results on research, but also the question of what are we looking into as a problem.
Yeah, and I think that also, before I come over to you, Catherine, it's what Helena said is that women are suffering needlessly. They don't get help.
Pain.
And if it was men that had all these kinds of problem, would they get help? Because this is such a big difference.
Exactly.
What do you think about that, Catherine?
Yeah, but I am sitting thinking that in the Old Testament, in the first story we have Adam and Eve, and Adam has been translated all during the Bible to be the human. I don't know what went with Eve, but Adam is human, right? And this is exactly backing up the approach in research for decades, maybe forever, that you are looking at the male as a human, and then you have women, sort of, and we are humans because of... Okay, sort of, because we are dealing, because of we are women, with special health things that then are being generalized. And that was what we also talked about now we are screening us, thank you. And then we have the menopause as well. And I can see some of you out there might be having the same experience like myself. Somebody calling me because of my age, saying you are to be with me in my podcast because we are talking, with publicly known women about menopause. And they would never ask me, my daughter, for instance, they would ask me because this is the menopause. This is like, what is it? It is a door or tunnel that the women of the world are going through, and there will be a lot of stuff in there. And they're not really talking about the specific issues in that tunnel that they want to treat. Because when you go to your doctor, I tried it, she will look at me, it's also she is sitting there saying, this is probably because of the menopause, And I'm just asking, why isn't there menopause for men? Why is it that men that are going for being, grown-ups to being older, there must be a door somewhere for them as well, a corridor they have to go through. But no. They have issues, specifically out there, and they will be treated exactly there. So I'm not buying the menopause as we're talking about it today. I think actually it's oppressive to talk about menopause like it's something we all have. Then we could talk about there is a door, a corridor for all people going for being grown-ups to being old. Let's talk about that.
It's also very physical.
Yeah.
And it's also physical.
Yeah,
Yes.
but Catherine, what you mean is that it doesn't matter if it's menopause or something else. You should get the help that you need.
Exactly.
It doesn't matter if it's menopause, if the man has been, the shoulder, whatever it is.
Exactly. Get off my age. My age is my age. Don't give me that. I want to be treated like a human being, like Eve, actually.
Yeah, and,
Thank you.
And during life, it's been working hard, the body. So, of course, things happens in your body as well. But the thing is that there's so many women that can't go to work because of the problems. Yeah. And the men does. Do you think that if the men did have the problem and didn't go to work, do you think that we have been looking at it in another way then?
That's such a funny question, isn't it? It's a trick question, isn't it? Because we have Viagra. We have Viagra. Yeah. We haven't got the pill for men, but we have the pill for women. Do we have a pill for women's orgasm? Sorry to mention it. You're not supposed to have one, are you?
Can I-
Especially not after you have given birth, really.
Yeah, but we actually do have. We heard something about they have Viagra, right? But you said
But if
something.
men would give birth, there would be a zipper.
Yeah.
There would be only one birth per man, no more.
But you mentioned something about
exactly.
that.
Another thing concerning research and the imbalance, there was actually research done on a woman's Viagra, and this is 2015. I mean, this is 21st century. And they were looking at the side effects. And it was a small pilot study, and it was done on 25 men, and there were 2 women included. And this is a drug which was a female Viagra, and FDA approved. It's unbelievable.
Did the 25 men
That's
get
blindness.
orgasms then?
They were at that one. They were looking at the side effects, but still side effects which can be totally different between the sexes and the metabolism, and for many reasons. And it just shows this bias still, because we are still being astounded by the statistics. That's why the data is so critically important.
Yeah.
And then there's a discussion and changing things.
Yeah, but I also think it would be interesting to see if the cost to the society, if women got the help that they needed, what difference would it make for the country economy?
Exactly.
Treated them and they can work or not. I mean, it's kind of a discussion as well.
But isn't it also that we are still very old-fashioned in our health programs in Scandinavia compared to the US example, where you are more focusing on preventing than curing? We are still curing and not preventing. And it takes some time, and hopefully it will happen in my lifetime, that we go from curing to preventing instead, because it would be better for all, wouldn't it?
Yeah. Eva?
I think we have actually, in our public health system, we are very focused on preventing, but it hasn't perhaps developed in recent years in the way that it should have, because we're very early in child-mother care, these kind of things, which was about preventive. So I think we do have the basic knowledge, but I think the gender sensitiveness has somehow not developed enough. And I think going even further, we are not aware that there are different kinds of women who face a lot of manifold issues because, for instance, if you have mental health, we know that it's really difficult to be listened to for somatic problems. You are not sort of credible. And this story goes, I don't know how much research there is, but you hear it over and over again, that if you have depression in your papers, everybody are waving away all the other issues, in particular with women. So there is this kind of stereotypical idea of looking at a woman also, which is perhaps not only medical, it's something deeper in our societies, in our culture. Yeah. But of course the medical should be more aware about it and should be trained. I made a motion in Helsinki City Council about the menopause advisory, some kind of, that there should be somebody who knows something about it. I actually looked at Sweden and then I tried to do it. And I got this response from municipality, our experts, that, well, all doctors know about this. And I was, well, no, they don't.
No, they don't.
But, this is the idea that, that we already know enough about gender, and actually we don't.
I think that Nora and Christina also, it's really interesting to hear you. We're kind of running out of time,
yes,
but I really want to hear you, Nora.
I think the Nordic countries have been great at focusing on equality between the genders, right? But I think when it comes to health and medical research as well, maybe we have been too focused on equality and not enough on equity, right? I think what we've learned in recent years is that women do require a different level of healthcare, more perhaps a different perspective when it comes to how we're treated in the medical system. And I think focusing more on the equity and less on the equality, I think when it comes to health is a much better perspective.
Interesting.
And concerning this issue, women appear to be more likely to get these diagnoses if complaining of anxiety or perimenopausal or menopausal or whatever, and depression. We need to be wary because they often present with more emotions. And this is one of the things we are now teaching in communication in medical school. You have to look at these things very holistically and be aware. But absolutely the only way forward, and in Nordic healthcare and any, is lifestyle medicine. It's more than just prevention. It's the way we live. If we live a healthy lifestyle, we feel better now and we'll feel better later. And it's these diseases of today, and we're starting to talk about allostatic load. All of these things which load onto life, whether it's all of these stressors and the way that we are changing society. I mean, we adapted as these human beings and evolved, but modern society has never evolved at such a fast pace. I love the progression. I am happy to live these times, but we are doing so many things concerning pollution, whether it's noise, whether it's light, whether it's all of these irritations, whether it's these phones, which are great, but we are in control of them. There's no reason for people to be able to reach us 24/7. And then with the technology, everything is changing more. And of course, we have wonderful changes, but we need to be aware of which changes are important for our well-being and health, and which are not. So progress shouldn't happen just because it can. We need to be aware of that and take that into the lifestyle factors, because therein lies so much prevention, and especially with all of these lifestyle diseases, which are such a burden of the healthcare system. And
now you're into
absolutely.
what we're gonna end this discussion, because we do have different topics today. But if we're gonna come back another time, what kind of topics you live it into it? But what kind of topics do you want us to bring up to the table? Now we don't have time to discuss it, so just briefly, the five of you,
Yes.
what is the most important for you?
We absolutely need to take well-being and care into the thinking of how we evaluate the economy. And that has to be looked at for sustainability of health and our environment. And this consumerism, where the marketing makes us unhappy and increases our stress, increases allostatic load, makes us unhappy with what we are, and we need more and to be different. And then this massive consumerism on our earth and our connection to nature. I would like to lift at the very end a feminine trait, even though some people, we feel we're in a man's world created by men, but there are feminine aspects which have always come through. One is justice, Lady Justice, in many cultures. The other is Mother Nature. And our connection to nature, we are part of nature, and we have to take that into account in all decisions that we make.
Eva, what do you want?
Well, I actually think we should talk about more, as a politician, the rights-based approach, that, you know, that the women have a right to their own bodies. And I believe that we cannot take it for granted, even in our Nordic countries. I mean, it's about sexual and health rights. It's about safe abortions. We really need to talk about, you know, that the woman has a right to live a healthy life without pain, getting treatment for what she feels is important, not sort of being evaluated by others, you know, what should be important for her. I think this still is, it's really about basics in gender equality and women's rights, also in health.
Yeah, and Catherine, women in health.
I will first of all thank you, Hologic, for calling to this conference, and I think it shows a very severe democratic problem that are broadly unknown also to our politicians. And it's an ethical problem, of course, and I will take it personal to and inspired by this to our ethical country council in Denmark that I will meet next week. I think they should go into that topic, but I also think that the Minister of Health in our countries and on equality, I will take it to those two as well, because I think we do not really recognize this problem, and we should talk more about it. And then I have a wish. And I know, but you may wish more. It's not Christmas, but you can wish a little now. And I think if Hologic could see into inventing the pill for men, I would be so thankful, being the mother of 3 daughters and a grandchild coming up, because I think equality between men and women in this world will stagger, will not really we will not together join the responsibility for the children, from the home care, and for the working life, or for the all social, our nation simply. If it's still and always will be the women that are to bear the children and take the responsibility for being pregnant or not, basically. If the men could have an answer into that also, I think we would come far ethically and also to join spiritually, to meet men and women on an equal base, also privately. Thank you.
Thank you. Nora? Nora?
Yeah, again, I just want to echo what the others have said. I think, events like these are so important, spreading awareness of women's health and the issues that we're facing. And I think that's the most important thing. And I think that's what's going to drive us forward, is just keep creating awareness and keep demanding that this issue is being taken seriously. And I think that's only going to happen if we keep talking about it and we keep bringing it to the forefront of the things that we're talking about in the media. And I think that's essentially what I want to end this on, is just we have to be the people driving this forward, and we need to keep creating that awareness.
And Susanne?
Yeah, well, I also want to thank for this meeting today, and I think that these topics are worth to repeat and to dig deeper into, really. And I think also we women, we have to get loud, we have to claim our rights. We know what is wrong and we have to speak up. We do that from time to time, but and I just, it came to me as we were talking about menopause, women and women menopause. There is a treatment in breast cancer, that men can also get breast cancer, even though there are very few of them. And when they do, mostly hormonal, they get the same treatment as the women, which puts them into menopause immediately. So my suggestion is to give this to the politicians that are against all these, just to let them know how it is to have these difficulties as a woman.
So that what we can say is that at least that we have different topics to the next meeting, and also that it is big differences in the equality. And just to have an example, if you haven't really noticed that it's actually not equal between men and women in research and stuff. Did you know that women are much more than men suffer from whiplash injuries when they are hit from behind? And keep that in mind when I show you this picture. The first crash test dummy was introduced in 1949, a dummy with average male build and average male weight. That has been used by traffic safety researchers ever since. Recently, we got the new news that finally, over 70 years later, there is at least a prototype that actually have a first crash test dummy modeled for after average women's body. And that took like 70 years.
Yeah.
So we have, there is things to do, and I'm very grateful to have you here. And thank you so much for what you have given us. And I really hope that you also, that are here, bring something with you to the table where you can make change. For me, it's, we are human, we are men and women. We shouldn't be needed to be here today, actually. I think that we are here, honestly, is because of something is not fair. And every human being need to get respect, get the chance to get help with their health issues. It must be a change so men and women can run this world and live this world and life together. Healthy. Thank you so much. And before we end this day, because now I see that we're a little bit late, 5 minutes, but we're going to have lunch soon. I want to introduce Tanja Bricker again. Thank you so much to the panel again.
Thank you. Should we leave?
Ladies, thank you so very much for the time and the investment. I know when we come onto a stage, there's a lot of preparation in terms of the messages that we want to give. I heard your voices loud and clear. Also heard the call for another one of these conversations, and so we're committed to having this conversation annually. We will be back again next year, and I've made a note of all of those topics that we want to add. I will add one more there, and it's from a medical device perspective. I've worked in the industry now for 30 years. And what I've seen in terms of the time frame it takes for reimbursement or recognition or registration of devices for women's health versus devices for men's health is extraordinary. The disparity is huge. So I'm going to put that one on the agenda as well. And I would call for the audience to be populated by regulators, by people who make decisions about how quickly and the level of reimbursement that we might have for medical devices. Breast density was mentioned. We have the technology for breast density. We can quantify and qualify and inform women about breast density. But getting that accepted, utilised, it's an extraordinary journey of many, many years. Artificial intelligence can help bridge the gap between the number of trained clinicians that we have to read mammograms and what we've got currently in terms of a disparity or a gap in that workforce. Getting artificial intelligence accepted is another one of the challenges that comes ahead of us as a medical device and technology company. So we're here making those investments, and I guess my call to the regulators and to all of those people who make the decisions is give us an opportunity to get these women's health products on the market faster so we can actually make a difference. But I would like to thank Alexandra, Eva, Kirsten, Chris, Catherine, Susan and Nora very much for your time, your preparation. We have a small gift for each one of you. Thank you very much. And Michael, if you wouldn't mind coming up. Michael is our General Manager for the Nordics. To the audience, thank you very much for committing your time, your participation. To the gentlemen in the audience, thank you for being here and listening to this message. I know sometimes that's a little confronting. To the ladies, thank you for giving us your time. Awareness, access, affordability are the three words, if you take nothing else away from what I've said today. Take those three words and one more, and that's action. We can talk about this a lot. We've been talking about it for 2 years. Now it's time that we take some action out of all of this fantastic debate. Thank you very much.